This government has repeatedly claimed that this is a tax on businesses, not a tax on working people. How wrong they are. Not only wrong, but deeply disingenuous to those people that we represent, who will see prices increase, see their chances of employment become more difficult, and see many businesses have to wind down or restrict their operations. The owner of the Barley Mow pub in Hertford wrote to me expressing his concerns and frustration at the lack of detail the government has provided with regards to support for the hospitality industry. This echoes the representations made by Hospitality UK, who have said the tsunami of employment costs coming in April will ultimately do more to hamper growth than incentivise it. Increases to employer national insurance contributions and wages will make it harder for businesses to support employment and invest in their businesses. I would like to hear from the Minister, when she sums up, why the government wants to see the amazing pubs, restaurants and catering businesses in Huntingdon suffer this unfair, ill-thought-through and deeply unpopular jobs tax. Madam Deputy Speaker, the British Retail Consortium wrote to the Chancellor expressing their grave concerns about the impact this will have on businesses they represent, with our largest supermarket chains having to pass on these costs to consumers. And that's before we talk about the impact of this budget on farmers, but I'm sure the members opposite will have plenty to say about that tomorrow. But not only is it these businesses with high numbers of lower paid workers who will be impacted, but I've received many emails from GP surgeries and hospices who are terrified as to what this means for them. I want to pay tribute to the Cambridgeshire Local Medical Committee and the work that they have done in raising that the average GP surgery in Huntingdon, with just under 14,000 patients, will face an increased cost with the minimum wage and national insurance changes of approximately £48,000. This money is equivalent to the salary of 3.5 sessions of a newly qualified GP, 1 full-time equivalent nurse, almost 2 full-time healthcare assistants. Added to this, a GP who has served Huntingdon for 30 years has told me that these increased costs might see many practitioners hand back their contracts. And who suffers from this? It's the staff of the Moat House Surgery or Grove Medical Practice who could be out of jobs. It's the patients of Priory Field Surgery or Brampton Surgery who might lose their GPs. Dr. Duncan Outram and Dr. Barbara Zicka, who have a combined 62 years of service in the NHS, 50 of which have been serving Huntingdon, have also told me that the estimated black hole of £37,000 is causing them great concern, not only of their future plans, but also risk seeing more young health professionals leaving the NHS. GPs serve our communities in the most amazing way and are a key part of medical care for so many of us. Yeah. Therefore, the impact that this will have on NHS provision is deeply damaging and must be reviewed. We need to protect the NHS to ensure that our constituents get the care that they need. This policy does the opposite. Added to the list of those concerned are the hospices, who are already so overstretched and, despite being a key part of end-of-life care, terrified of the impact of the amazing care that they offer. Furthermore, we have hardly heard what this means for our armed forces. And whilst we constantly hear from the government that they are prioritising national security, we do not know what the potential impact of this will be on the MOD's budget. All of this shows that the government is rushing into implementing something without any detail of what the impact will be in so many areas. To conclude, Madam Deputy Speaker, I would urge the government to rethink and have the moral courage to take ownership of their mistake. If they go ahead with this policy, we will see people lose their jobs, businesses be unable to expand, care provision being stretched even further, and working people suffering. So I say to the government, go back to your manifesto and say no to backdoor stealth taxes on working people. Yeah.